for joining today's conference call with Governor Andrew Cuomo. I will now turn it over to Governor Cuomo.
Good afternoon, guys. I want to make sure everybody's working on a Friday afternoon. It's not even 4 o'clock, so I don't feel bad about keeping people late. I have on the telephone Melissa DeRosa, Robert Mejica, Jim Malatris, Howard Zucker, Gareth Rhodes, Beth Garvey. Follow the data. Follow the data. Give love, get love. The data says, today's day 279, the overall state with microclusters 5.4, overall state without microclusters 4.7, microclusters 7.3. 60 New Yorkers passed away. They're in our thoughts and prayers. And that's the most important number of the day. Hospitalizations up 159. 795 people in ICU, that's up 12. 403 intubated, that's up 26. If you want to look at the numbers across the state, positivity by region: Western New York 7.4, Finger Lakes 6.6, Central New York 5.7, Mohawk 5.7, Mid-Hudson 5.4, Long Island 4.8, North Country 4.2, Capital Region 4.1, New York City 3.8, Southern Tier 2.75. Good for the Southern Tier. The infection rate is not all is not that relevant anymore. We're really focusing on the hospitalization rate and hospitalization capacity. Hospitalization rate as a percentage of population, right? It's not just the raw number, it's a percentage of the population. Western New York and Finger Lakes are at the top at about 0.03. Central New York is also 0.03. Mohawk Valley 0.03. Mid-Hudson 0.02. Long Island 0.02. Southern Tier 0.02. Capital Region 0.02. New York City 0.02. North Country 0.01. Okay? When we talk about hospital capacity, this is something that I think is important for people to remember. We do something different in New York. We do a lot of things different in New York. But when it comes to hospital management, we do things that other states don't do. We start with about 53,000 hospital beds, okay? We then have ended elective surgery in the past. We ended elective surgery in Buffalo as of today. Of the 53,000 current hospital beds, about 35,000 are occupied. If you end elective surgery, you vacate a percentage of those 35,000 beds. It depends on the hospital, but if you vacate 50% of the beds, that's another 17,000 beds, right? If you vacate a third of the beds, that's about another 10,000 beds, right? So that is an exercise, an option that we will exercise if we need to. Second, we have in the past, and we're prepared to again, mandate a 50% increase in hospital beds. That takes the 53,000 up to 75,000 hospital beds. So when it comes to hospital capacity, we have elective surgery cancellation, mandatory 50% increase, and then we have emergency bed creation capacity, where we can create several thousand hospital beds relatively quickly. We know that because we've done that, and we can do that again. So that's on the hospital capacity issue. We have flexibility in our capacity, hence the flex and surge plan. It's not that we were that creative in the name. It's just very descriptive. On the ICU capacity, some states, California, is putting in restrictions because they have an ICU bed capacity issue. Our ICU bed capacity is we have about, rough numbers, 6,000 ICU beds. Right now, we have about close to 40% of those beds available. Okay? California has an issue because they have about 15% of their ICU beds available. We have about 40% of our ICU beds available. So that is also good news for the state of New York. Another factor that you need to understand, we all have mild version of PTSD from what we went through in the spring. This spring, the hospital protocol, the medical protocol, was very different for COVID. Listen to this. In March and April, 25% of those hospitalized went to the ICU. 85% of those in the ICU were intubated. That then drove the ventilator crisis. Currently, instead of 25% going to ICU, 18% go to ICU. Instead of 85% intubated, only 45% are intubated. The length of stay in the hospital in March, April, 11 days. It is now less than half that. It's down to 5 days is the average hospital stay. So when you're talking about hospital capacity, people are in the hospital for less than half the time they were before. Even when you're talking about ICU capacity, the ICU capacity, when we had an ICU issue, it was because the ICU beds, we couldn't get ventilators for the ICU beds. They're not using as many ventilators on the ICU beds anymore. And then the most encouraging number, March, April, of those hospitalized, 23% died. That number is down to 8%. So God bless the medical professionals who have learned more about how to treat COVID, have more therapeutics, have better medicines and better practices, but the death rate has gone from 23 to 8%. I have inquired, because you know me, I make many inquiries. Most go unanswered. But I've inquired if the viral strain has actually weakened. Nobody will say that it has, but the death rate going from 23 to 8 is truly significant. Another development, the federal government is now offering an initiative where they will do the vaccinations for nursing homes and nursing home staff. They contract with medical companies, drug companies, to actually do the vaccinations of nursing home residents and nursing home staffs. A state can opt in or opt out. We are going to opt in to that program. So the federal government will be vaccinating nursing home residents and nursing home staff. They do the staff on a rotating basis. What we also are planning is there are about, let's say, 700,000 healthcare workers. Of the 700,000, about one-third are considered high-risk healthcare workers. We had this conversation. Not all healthcare workers are in a class classified as high risk. All 700,000 have a risky job, and I totally respect them. But of the 700, one-third are classified as high risk, treating COVID people in emergency rooms with COVID-positive people, etc. Within the next 2 weeks, we should have enough vaccine to vaccinate about one-third of that one-third, okay? If the federal government delivers as they say they will. And nursing homes and high-risk healthcare workers, they are up at the top of the list, right? Prioritize people to get the vaccine. Also, as I mentioned yesterday, we have about 30,000 data points on where COVID is coming from. Over 70% are coming from household small gatherings, which are really beyond government control, right? Despite the CDC saying you should only stay with your household. New York and about 20 other states have a rule of no more than 10. But it's really beyond the government's ability to enforce. But there are restrictions in bars and restaurants, in gyms. There are capacity restrictions. There are protocol restrictions. I need the local governments to enforce those restrictions. The lack of compliance is a problem. I understand COVID fatigue. I understand people are resentful of these regulations. I get it. But if you don't enforce the restrictions, and if the restrictions are violated, then they're pointless. And they have to be enforced. And I need the local governments to do the enforcement of the restrictions. Our largest two problems right now, one, the 70% spread, small gatherings, aggravated by the holiday season, and two, lack of compliance on the restrictions, which is social fatigue, social resentment, social noncompliance, and lack of government enforcement. Because a law is a law. Well, people don't like the law. There are laws that I don't like. But the law is the law, and the law has to be enforced. And I need the local governments to do it, because that is an increasing problem, is the lack of people following restrictions and the lack of local governments enforcing the restrictions. Now, people say, it's political, Democrat, Republican. And this is a narrative that is out there, let's be honest. Certain publications are pro-Democrat, certain are pro-Republican, and they each make their case. This is not a political issue. New York State said no more than 10 people. About 20 other states said no more than 10 people. President Trump's CDC says no one beyond your household. So the Republican rule, no more than anyone beyond your immediate household, is much stricter than this state's rule. The President Trump's CDC just came out and said you should wear a mask indoors if it's not in your own home. Okay? That's a Republican administration that said that today. So forget this narrative, this hyper-politicalization, New York Post, we're Republicans, Democrats are bad, Democratic rules. It's President Trump. It's his CDC director. They are proposing restrictions much stricter than any restrictions we have imposed. So if President Trump believes in the restrictions, if President Joe Biden believes in the restrictions, then stop with this political narrative dividing people, because there is no politics. And I understand everyone wants to view everything through a political lens. We're in the holiday season. People don't follow the restrictions. They don't follow the CDC guidance. You're going to see an increase. 1 plus 1 equals 2. 1 plus 1 plus 1 equals 3. 1 plus 1 plus 1 plus 1 equals 4. Right? These are facts in life. I'm just giving you facts. I'm giving you data. These are numbers. There's no spin. There's no politics. There's no ideology. It's not saying I believe this. These are just numbers. So let's leave the politics at home. At the same time, New York State still lowest infection rate in the nation, except Maine, Hawaii, Vermont. We're at 4.4. Above us is Massachusetts, 4.8. Above Massachusetts is Connecticut, 5.4. Above Connecticut, Alaska, 6.2. Maryland, 6.2. Delaware, 7.6. California, 7.6. So, relative to the nation, we are doing very, very, very well. By our hospital capacity, we're doing well. By our ICU capacity, we're doing well. By the household spread and small gathering spread, that's our problem. People not following restrictions, local governments not enforcing, that's a problem. And that's where we are. And the vaccine is the weapon that ends the war. The question is how long it takes. Okay, with that, let's take a couple of questions. And then, happy Friday evening.
Thank you, Governor. Ladies and gentlemen, if you would like to ask a question, you may press star, then the number 1 on your telephone keypad. Once again, you may press star 1 to ask a question. Please stand by while we compile the Q&A roster. Your first question comes from the line of Zach Fink from New York One. Your line is open.
Hey, Governor, good afternoon.
How are you, Zach? Good to hear your voice.
You too. I did want to ask you about the Young Republican Club, which was looking to hold their gala originally in Chelsea, and then they kind of couldn't find a space. Ended up in Jersey City. Governor Murphy was very unhappy about it because there were photographs tweeted, people not socially distancing, not wearing masks. I was curious just to get your take on that. And, I guess, can you blame Governor Murphy for being upset?
No. I don't blame Governor Murphy for being upset. I think Governor Murphy is right to speak the truth, even when it is politically inconvenient. This is a time for a leader to say what needs to be said and do what needs to be done, even if not politically appreciated by all. This is about saving lives. If the young Republicans broke the law should be enforced. If you allow the restrictions not to be enforced, Zach, people will not follow the restrictions. If you don't give speeding tickets, people will speed. That's the way it works. And that's my point about local governments that are not enforcing the restrictions and not using their police departments to enforce the restrictions. Look, I want to see young Republicans grow into old Republicans, right? This is about preventing deaths. Religious services, I want people to attend religious services. I just don't want them to be funerals. It's about protecting life. And I understand everyone's trying to politicize it. New York Post politicizing it today. CDC, they want to say who's not following the rules. The big picture should be Donald Trump not following his CDC rules, right? So stop with the politics. It's rules that save lives. Democrats, Republicans, short people, tall people, and rules that reduce the hospitalization rate, which is costly economically, socially, and literally in number of deaths. I have freedom to do what I want to do. Yeah, but does your freedom and irresponsibility allow you to put a nurse's life in danger and a doctor's life in danger and the EMT's life in danger? That's the other question. I want to live life the way I want to live life. Yeah. Okay, let me ask you this. If you get sick, will you agree not to go into a hospital? Will you agree that there's no cost to the public? That no person has to come to your aid? That you'll just stay home in your own bed and whatever happens, happens? I haven't found a single person who agrees with that. I want to be for my freedom. But if I'm sick, 911, get me an ambulance, EMT driver, get me a nurse, get me a doctor, put me in a hospital bed, cost taxpayers money, cost insurance companies money. My freedom at your expense. No, it doesn't work that way. Next question, operator.
Thank you, Governor. Your next question comes from the line of Marcia Kramer from CDS. Your line is open.
Good afternoon, Governor. How are you doing today?
Marcia.
So I actually have two questions. As I always
you only get one question. You only get one question. It's Friday afternoon. It's after 4 o'clock.
It's tough. I'll make it quick. So one is just a quick follow-up to Zach's question, because one of the people who went to that Young Republicans event took a picture with Congressman Gates, and he said, he taunted you. He said, "Hey, New York Governor Cuomo, I'm at the New York Republicans Club with Matt Gates. Come and get me." So I wanted to know your reaction to the fact that they're taunting you that because they couldn't do it in New York, they went to New Jersey. And my second question is really quick. What are you going to do to educate people that they should take the vaccine?
First of all, they couldn't do it in New Jersey either. New Jersey's rules are similar to New York's rules. Why they chose to go to Jersey to violate the rules rather than violating the rules in New York, I have no idea.
Maybe they were just afraid of you.
Well, yeah, I see, because tough guys tweet from across the river. That's not what we considered a tough guy back in Queens, I want you to know. I'm a tough guy. I'll tweet at you from across the river. Come swim and get me. No, it violated the New York rules. It violated the New Jersey rules, and I think it's so irresponsible for an elected official who makes laws to encourage people breaking laws. What is this elected official? Follow the rules and laws that you pass that I like? Well, I don't like your tax law. So does that give me the freedom not to file my taxes? I don't like your helmet law. Does that give me the freedom not to follow your helmet law? And it is also disrespectful to the New Jersey prosecutors. What do you think, that New Jersey is less competent than New York in enforcing the laws? That's a mistake, because the Jersey City prosecutor said something to the effect of, not to quote him directly, Governor Cuomo can't come and get you, but I can. They violated Jersey's laws, and Governor Murphy is right to point it out, and the prosecutor is right to say he will enforce the law, and elected officials are reckless and irresponsible to pander to the crowd that says we want to violate the law. Then don't be a government official and don't pass laws, all right? Because not every law is popular. And we don't have a system where we say, I pass laws, but you only have to follow the laws that you find agreeable. It doesn't work that way. Next question.
Thank you, Governor. Your next question comes from the line of Kevin Mayer from News 12, Long Island. Your line is open.
Hello, Governor. Quick question just about high school sports. Last we heard, you and Mike, this was about a month ago, was leaning towards not allowing the high-risk sports, and that was kind of a maybe, but you want to look into it further. Do you have a concrete decision on that yet?
Was that me and Mike? Mike who?
Your budget director.
Oh, that's Rob. You can call him
sorry
Mike.
about that. Sorry.
That's all right. That's all right. I call him Mike a lot. But he doesn't respond. Let's call him Rob and see what happens. What do you say, Rob?
Rob. Come on, Rob. What do you got?
No, Governor. No, we are still holding, right? We said as we're looking at what the infection rates are doing, and the infection rates continue to increase. So we're not in a position to put out guidance for the high-risk sports to continue, which is what we were referring to. So as of now, the decision is we're not turning on those sports while the infection rates continue to increase.
Operator, let's take one more.
Thank you, Governor. Once again, if you would like to ask a question, press star 1 on your telephone keypad. Your last question comes from the line of Dan Track from 13-1. Your line is open.
Good afternoon, Governor. Thank you for taking our questions today. I appreciate it.
Well, I normally don't work on a Friday afternoon, so it is a big sacrifice.
Yeah, me either.
Yeah.
Listen, first question. We're getting some reports. We're hearing through the rumor mill right now that following the COVID vaccinations in nursing homes, visitation will cease for 1 year. Their families will not be able to enter those facilities to visit with their loved ones. Is there any validity behind that? And then I do have one follow-up for you.
I didn't hear that. Let me ask Mike. Did you hear any? Because Mike is tuned in to the rumor mill. He's budget director, but he also monitors the rumor mill for us. and is also very wired into all the gossip circles. So I never heard anything like that. But, Mike, have you heard anything?
There's been no discussion about any long-term restriction like that, no.
No.
Okay.
And he would know. He would know.
And then lastly, if we're focusing more on hospitalizations, right now in Monroe County, there is a yellow zone on the outskirts of the county and an orange zone, including Irondequoit, Rochester, Brighton, areas like that. If we're focusing more on hospitalizations, what is the likelihood that we will see a change to that color coding system in the near future that might either increase restrictions in those areas or lift restrictions in those areas? Because I mean, just because I live in a yellow zone, I could still be going to the hospital in the orange zone.
Yeah, no, I understand, and we're watching the hospitalization rate. I want to get a sense of what the hospitalization rate is on the post-Thanksgiving surge that the medical professionals are talking about, and then we'll use that to recalibrate zones. But we have you can come up with as many zones and as many colors as you want. If the local government, we have our initial problem is, or our immediate problem, restrictions are only as good as the local enforcement. And we have many restrictions being violated routinely without local enforcement. Yellow zones have regulations and restrictions. Orange zones have stricter regulations and restrictions. Local governments have to enforce it. They can't use ancillary police departments. It can't be just a health department that does it. Because the violations are increasing. And at one point, if the violations continue to increase, it makes the restriction and it makes the zone impotent, right? So I want local governments to understand. I get the COVID fatigue. I get the political pressure. They need to do more enforcement than they are doing. If I had enough state police, I would do it myself. I don't. I have used the state police and state officials to do the bars and restaurants. Frankly, we did it more effectively with 1/50th of the personnel than the local governments have done it, right? I have 5,000 state police. New York City has like 32,000 police officers, just New York City. So they have the personnel. They have to do their job. And we're coming into another weekend. The CDC guidance was just updated. More cautions about small gatherings, more cautions about wearing masks. The numbers are going up. The hospitalizations are serious, and the hospitalizations are inarguable, right? Well, I don't know what the infection rate means. Well, I don't know. I think it's a hoax. People go into a hospital. They don't go into a hospital if they're feeling well. They don't go into a hospital to play politics. They don't go into a hospital if COVID is a hoax. They go into a hospital because they're really sick. That number is going up. Please, a little bit of rationality and sensibility and a little common sense. Please, be smart. Yes, the vaccine is here, but you're not going to get it tomorrow. And you're not going to get it in January or February or March or probably even April, unless you're in one of these high-risk categories. So don't be deceived. Well, it's over. We have a vaccine. We need people to be diligent, and I need local governments to do their job. We are within sight of the goal line, but we have to get there. and we have to get there together. Thank you, guys. Have a good weekend.
Thank you, Governor. Ladies and gentlemen, this concludes today's conference call. Thank you all for joining. You may now disconnect.